Blocked nose, no smell, no sleep? It might not be a cold, it could be nasal polyps. Let's uncover the truth. What are nasal polyps? Nasal polyps are soft, non-cancerous growths that form inside the lining of your nasal passages or sinuses. They are usually teardrop-shaped and can vary in size. Some are so small you don't even notice them, while larger ones may block your nasal passages and cause serious breathing issues. Polyps are the result of chronic inflammation, when the tissue inside your nose stays irritated and swollen for a long time. Unlike cancerous tumors, they are benign, but that doesn't mean they are harmless. They can cause discomfort, frequent infections, and long-term health problems if ignored. Scientists believe that in people with polyps, the immune system reacts differently to inflammation, leading to abnormal tissue growth. Polyps are often linked with asthma, allergies, sinus infections, and sensitivity to certain medications like aspirin. Causes and risk factors. The exact cause of nasal polyps isn't fully understood, but experts agree on one thing: they are strongly tied to chronic inflammation. Common causes: allergies. Seasonal allergies trigger inflammation that can encourage polyps. Asthma. Many asthma patients also suffer from nasal polyps. Chronic sinus infections. Repeated infections make the nasal lining weak and swollen. Immune system imbalance. Some people's bodies respond abnormally to irritants. Risk factors. Age. Polyps are more common in adults over 30. Family history. Genetics play a role. Aspirin sensitivity, known as Samter's triad when someone has asthma, nasal polyps, and aspirin sensitivity together. Environmental irritants. Exposure to dust, smoke, chemicals, or pollution increases risk. Understanding these causes is key because managing inflammation is the foundation of treatment. Symptoms. Nasal polyps can sneak up on you because they grow slowly. But once they get larger, they create noticeable symptoms. Constant blocked or stuffy nose, runny nose, or postnasal drip difficulty, breathing through the nose, loss or reduction of smell and taste, frequent sinus infections, headaches or facial pressure, snoring, or sleep disturbances. Some people confuse nasal polyps with a prolonged cold or allergy. But if your cold lasts more than 10 days and doesn't respond to medicine, it might be nasal polyps. Diagnosis. Doctors use several methods to diagnose nasal polyps. Nasal endoscopy. A thin tube with a camera is inserted inside your nose. This helps doctors see the polyps clearly. Imaging tests, CT scan or MRI, shows the size of polyps and whether they're blocking your sinuses. Allergy testing to check if allergies are the main cause. Blood tests, sometimes done to rule out immune-related conditions. Early diagnosis is important because untreated polyps can lead to chronic sinus infections and breathing difficulties. Treatment options. Treatment for nasal polyps depends on how severe they are. 1. Medications. Nasal corticosteroid sprays reduce inflammation and shrink polyps. Oral or injectable corticosteroids used for larger or stubborn polyps. Antihistamines for allergy-related polyps. Antibiotics only if there's a bacterial infection. 2. Surgery. When medications don't work, doctors may recommend endoscopic sinus surgery. This minimally invasive surgery removes polyps and clears the sinuses. However, surgery doesn't guarantee that polyps won't return, so lifestyle management is still important. 3. Lifestyle and natural remedies. Saline nasal rinses helps clear allergens and mucus. Steam inhalation opens airways and reduces congestion. Turmeric and ginger, natural anti-inflammatory foods. Garlic and onion support immune health. Vitamin C and zinc strengthen the immune system. Prevention. While nasal polyps can return, you can lower your chances with these steps. Manage allergies early to prevent constant inflammation. Use a humidifier to keep nasal passages moist. Practice good hygiene. Wash hands, avoid irritants. Avoid smoking and secondhand smoke. Rinse your nose with saline regularly. Consistency is key. These steps reduce flare-ups and help keep polyps under control. Living with nasal polyps. Living with nasal polyps can be challenging. It affects sleep, concentration, and even emotional health due to constant discomfort. Many patients feel frustrated by repeated treatments. But the good news is, With the right combination of medical treatment, natural remedies, and lifestyle adjustments, most people can live symptom-free. It's also important to follow up with your doctor regularly, especially after surgery, to check if polyps are coming back. Early detection and management prevent complications. Nasal polyps may be small, but their impact on your daily life can be huge. The key takeaway is this: treat inflammation, manage your triggers, and don't ignore persistent nasal symptoms. With proper care, you can prevent complications and breathe freely again. Thank you for watching this video on BeFitest. If you found it helpful, don't forget to hit the like button, subscribe for more health insights, and share this video with friends and family who may benefit. Stay healthy, and remember, prevention is always better than cure.